The member for Merrimack-Cook-Tantramar.
Thank you, Mr. Speaker. I'm pleased to rise in the House today to speak to, I guess, Motion 8 and the amendment that has been made to it by the Minister of Health. And I guess I'll start by looking at what the amendment says, which is that we need clinically appropriate care that fully meets the needs of our community. And I guess, as with the original motion, I feel that what is being put out there is pretty reasonable. That we are, requesting that services, the motion requests services be maintained and that they be clinically appropriate. Does seem reasonable. That language has legal significance. And from my quick search for what the definition of clinically appropriate is, it's that it is provided in a timely manner, meets professionally recognized standards of acceptable medical care, that it is delivered in the appropriate medical setting, and that the least costly of multiple equally effective alternative treatments or diagnostic modalities be used. It seems to me that this should always be what we expect of care within our healthcare system, that it is timely, that it's using acceptable standards of medical care, that it's in an appropriate setting, and that if the choice is made for the least costly choice, that it's of equal effectiveness to the alternatives. So the language of clinically appropriate seems to make sense, and I believe that it always should be clinically appropriate when healthcare is administered in our healthcare system. I would say that, so as I said, shouldn't all healthcare be clinically appropriate? One thing that I do wonder about, that raises concerns for me, is does this open the door for cutting services, or what does this mean? How could it be interpreted and applied? So again, yes, we should have clinically appropriate services. However, does that open the door to potentially cut services in certain areas? It's all about how this would be interpreted and implemented. And I would agree with some of what was said by the Minister of Health. Of course, you can't have every single healthcare service available in every single location. And I don't think New Brunswickers expect that. However, there are certain services that should be available and accessible no matter where you live in New Brunswick, and maybe not within 1 minute of where one lives in a rural area. But I think when we're talking about healthcare, we need to be aware of the things connected to healthcare that might not fall under the Department of Health budget, for example, but that significantly impact people's access to healthcare. So perhaps there will not be an oncology department in the Sackville Memorial Hospital. Okay? So someone living in Sackville or somewhere in Merrimack-Cook-Tantramar, let's say they do need to go to Moncton. Let's say it's a half hour or 45 minutes, depending on where someone lives. That isn't unreasonable for most people. The challenge really then is, how do we reduce the barriers to access? How do we make the treatment more accessible? Because there are people who don't make it to their appointments and don't receive the care they need because they don't have access to transportation. So we need to be looking at the barriers around income, around transportation, things like this that prevent people from accessing the care they need. So it's not, so me, when my dad was sick, to use a personal example, he moved in with me. I was able to drive him to the Moncton Hospital to get treatments. There are people who are unable to do that. My dad didn't have a car when he was older. If I hadn't been there, how would he have been able to go and get his treatments? These are the types of questions we need to be asking, not just on what's happening with the services available, but are people able to get there? And I know there are people who miss appointments or don't even bother making an appointment because they just can't get a drive to where they need to go. So really, this is part of what we need to be addressing when we're looking at access to health care. We need to have a more holistic view of what this means. And I acknowledge that, when we're talking about maintaining the existing level of service in all of New Brunswick's regional and rural hospitals, that one of the parts of the challenge is around labor. There is a labor shortage in certain areas and really across different parts of the healthcare sector. However, there are ways to address this, and it isn't always. Sometimes it's about spending more money, maybe increasing the amount that people are paid. School psychologists come to mind right now. I know that the salaries, from what I gather, are not competitive with our neighboring province of Nova Scotia. And so that's one place where money can make a difference. However, there are other ways to be creative that may cost less or may not cost more, but people can access service, have more access to service. And when government isn't doing it, sometimes private foundations or nonprofits or individual donors are doing it. So it can be done. And one example that comes to mind is the auxiliary, I believe it's the Women's Auxiliary Foundation for the Sackville Memorial Hospital. They've been funding a mental health care worker to go into Tantramar Regional High School on a weekly basis to provide mental health care support for students there. So there was a worker available, not hired by the government, but there was a worker available to go and provide mental health care for students in Sackville. And so it's not just about labor. It's about who's being hired, are they being paid fairly, but also how do we get creative around what that looks like. I understand there may be an absence of school psychologists, but what other mental health care professionals could be meeting some of the demand that's there? Because we have severely high rates of mental health issues across the population, and with youth, a third of youth have anxiety, a third of youth have depression. There's been a 46% increase in mental health, demand for mental health services across the population in the last year. The services that youth access, there was a doubling in the number of youth accessing mental health care. So I'm aware of people in my area, so if I know there's some in my area, in Memram, Cook, Tantramar, I'm sure that there's examples across the whole province of people who are available, who want to do more counseling, who want to run workshops. Some of them are just doing it voluntarily without getting paid. And I know that $4 million was left on the table, unspent, and maybe it was earmarked for school psychologists. There were other places that it could have been spent. If there is a shortage in one area, how could it be remedied, at least for the time being, by hiring others? So I think I do understand there's a labor shortage, and I look forward to seeing the concrete plans for how to address some of this. I understand it's a complex issue that will need to involve everything from immigration to training. I guess the Minister of Petal will be busy working on this in addition to the Minister of Health. Another way that we can be addressing this is to expand the scope of practice for some of the healthcare workers that we do have and allow them to bill Medicare. And I'm thinking of nurse practitioners or allowing pharmacists to do things like treat UTIs. This is done elsewhere. This could help to address some of the issues that we're having, to be creative and innovative in the ways that we're providing services. And one good example of something that's already being done in a rural area, there is a nurse practitioner that works out of Port Elgin Regional School, and people love having that service in their rural area. That means they don't have to travel as far. They're very happy with the care that they receive. This is the type of thing we need. In no way am I saying take away services elsewhere, but we need to look at what type of care can be provided more easily in rural areas. Another way to address this and to look at providing alternative types of care, possibly cost less, would be looking at midwifery care. And I know there's been a pilot project ongoing in Fredericton. I know that there's demand for other parts of the province to be able to access this, and I know that this would also help with people living in rural areas to be able to have access to midwifery care. I know the Moncton region, Memramcook, Tantramar area, I know in Fredericton it's an hour catchment, so let's say we had an hour catchment around Moncton area where people would be able to choose where they give birth and then also have access to midwifery care. And I think what we sometimes forget is that certain types of health care, when they're on the preventative end, they can save money down the road. They may save money right away too. When we're looking at preventative health care and when we're looking at different types of care like midwifery, where you have better postpartum care. This isn't a slight against right now, basically women in New Brunswick don't have postpartum care, maybe a 6-week checkup. To have that type of care, it improves outcomes and for both the baby and the person who gave birth. And so I think that there are ways to save money. I mean, we looked at the budget and estimates. I in no way think that the Minister of Health is trying to shut down all the hospitals in the province. We discussed the budget thoroughly in estimates committee, and there was a slight budget increase to basically keep things going. We also discussed how looking at preventative health care would save a lot of money, and that's where I think we really need to be focusing as well. How do we address mental health care? How do we address an aging population? An aging population, sure, there are costs. How are they aging? Aging doesn't necessarily mean that you will be sick. How are we aging? How are we addressing chronic diseases? New Brunswick could be healthier on a whole. There are things that we need to do to have better health outcomes across the population. It would save money for our healthcare system. So it's a win-win. And ultimately, if we're not looking at how to, obviously we need urgent care. You break your leg, you have a heart attack, you need emergency surgery. We need that type of care available to New Brunswickers. We also need to be looking at how to take care of people over the long haul. And our healthcare system wasn't really built to do that. And so how do we make that transition and ultimately save money and have better health outcomes? So in the end, as my time draws to an end, I feel like what we're discussing today, I would hope that all members of the House would agree that we need to be, maintaining and providing high levels of service in all of New Brunswick's regional and rural hospitals, and that doesn't mean every single service everywhere. And New Brunswickers are reasonable people. They understand that everything can't be everywhere. But how do we address the barriers that prevent people from accessing that care? Transportation, having a lower income, which is often connected in terms of access to health care. And then, as I said, speaking to the amendment, clinically appropriate, open to interpretation a little bit. Hopefully this isn't opening the door to cutting services. I don't think that's the intention of it, but clinically appropriate, timely manner, a high level of care, and in appropriate medical setting. We certainly need to to do these things. I think that everyone in the House would say that these are reasonable things, but ultimately, if we don't get a handle on preventative health care, then I think these things will become more difficult to achieve. So thank you, Mr. Speaker.